I am pro everyone being healthy, and I love the MAHA movement in general. I do fear, though, that we can't be MAHA at the expense of our freedoms.
Yeah.
And I want you to speak to this about our economic freedoms, our personal freedoms, the ability to choose what we want to do with our, to enjoy ourselves as part of the American experience. So how do we reconcile the two, that we want to be a healthier nation, but we also want to be free to choose what we want to choose?
I think you can have it both ways, and I think our industry epitomizes that. We're an industry that has been working on free market solutions to these health challenges such as obesity and diabetes, and doing our part. You know, we can't own all of it because we're only 6% of the calories in a diet, but we're sure gonna do our best to own that piece and do something about it. And I think that is far more powerful than government coming in and trying to tell people what's right, what's wrong, what they could have and what they shouldn't have. They can provide some opinions, but they should still empower that consumer with choice. I mean, that is the American way. And I think that's just a caution I would put out there is lawmakers now are working on these issues is, you know, don't leave important principles behind, free market principles. Rely on the private sector to do their job, push them when they need to be pushed, raise the issues so that, you know, they can respond effectively. And, you know, I think in our case, we're a model. I would argue this is an industry that the MAHA movement and the administration could hold up as doing things right, trying to solve the problem in a free market way, listening to them and their concerns, and being responsive and delivering too. It's not just, you know, words. Actions are what matter at the end of the day. And we're an industry that acts, and that's what makes it fun.